We are continuing the chats at Lumen Global, completing day 1, and I am privileged to introduce to you a remarkable cardiologist from Thailand, Dr. Damras Tresukosol. Damras, Savadika. First of all, I must share with you some thoughts on your most amazing country. I have known your country over almost 25 years, and the experience began in your hospital at Siriraj, where I had been asked to come and assist with some training with the laser, and around the same time His Majesty's mother was involved, and I got included in the care. Since that time it has been a privilege. I have been there numerous times to Her Majesty's Center at your hospital, and you helped us conduct 2 beautiful Lumen Global meetings. So I thank you for your leadership and your friendship, and many people who attended the meetings at Thailand, both in Bangkok, mentioned those as one of our best meetings. Let's continue on STEMI interventions in Thailand and beyond. Why are we having so much problem creating STEMI networks in Thailand?
Now, first of all, I have to thank you, Lumen Foundation, to have Lumen Global in Bangkok for 2 years. After that, there are some change. I must call significant change, because in the past, STEMI has been treated locally by each individual operator or by individual hospital. No signs of network involvement. After Lumen Global, we try to push everyone to look at the zoning of their own. And now there is much progress, Samir, for the change after Lumen Global. Now, Ministry of Public Health agree to set up 13 zones among Thailand country. We cover from zone 1 to zone 12 outside Bangkok, and zone 13 is in Bangkok zone. From zone 1 to zone 12, each zone consists of 8 provinces, minimum 8 provinces, cover around 5 million inhabitants. So 12 zone is 60 million. And zone 13, that is Bangkok, that is most difficult. Because in Bangkok, it is no man's land for the healthcare. We have different structure of health system. We have a hospital under university, under Ministry of Education. We have hospital under public health. We have hospital under military defense ministry. We have hospital under Bangkok Metropolitan. So it's no man's land. But from zone 1 to zone 12, there is a owner. The owner should be the Ministry of Public Health Heart Center. So I help them to establish at least 5 to 7 heart centers in the province. And then they do very best in STEMI network care. But we just step in to teach them how to organize the door-to-balloon alliance. We teach them how to combine the pharmacoinvasive and primary PCI. Before Lumen Global, every doctor in every hospital want to do primary PCI. But I said that it is not primary PCI, it is e-PCI. E means enthusiastic, eager to do, no anticipation of time delay. Sometimes they do PCI for 48 hours after chest pain onset. So I try to help them to establish the true regulation, through protocol. For those the hospital that is far from PCI receiving center, more than 45 kilometers, should have a pharmaco-invasive, first by streptokinase. Now we are on the process to have TNK TPA. Because of Samir, we did a pilot project 5 years ago to have the TNK TPA generic from India. Mm-hmm. And we get a very good result of those first 25 cases. We did an angiogram at 90 minutes to see the TB3 flow. The TB3 flow is excellent, above 85%. So we try to convince our national drug list to add TNK-TPA to the list of the pharmacoinvasive for MI. And now in Bangkok, no man's land, we managed to organize the STEMI network in west side of Chao Phraya River. Chao Phraya River is the main river. And we have control 2.2 million inhabitants in west of Bangkok. And the east of Bangkok is another flow zone that we have to discuss further how can we set up the STEMI network in East Bangkok. In West Bangkok is guaranteed that all patients who live in West Bangkok will receive primary PCI under the protocol, the ambulance transfer, and the understanding of the system, understand the protocol. So we focus on STEMI process instead of STEMI procedure. All interventionists are good in procedure.
Absolutely.
They can do balloon, they can do stent. As Dr. Shirish mentioned about your 9 minutes STEMI procedure, we can achieve at least 23 minutes median. So think we are the best for the procedure also, but we are focusing on STEMI process. Process 1, process 2, STEMI procedure, and STEMI process 4. That is my development for this 2018.
It's remarkable work. I congratulate you, and yes, I think doing the meeting over 2 consecutive years, bringing a whole team of exceptional experts from the world does make a difference. Why is it, however, so challenging? Like you mentioned, the no man's land. On the other hand, I have, by the way, noticed a similar situation in numerous other countries, including, of all the places, in Saudi Arabia. It was exactly the same way there. Nobody had clear ownership of the program. There was the military was very powerful, then His Majesty and the royal this thing had totally different. Then there was a third tier for the local people, fourth one for the immigrant workers, and there was overlapping and no clear direction as who was in charge. Now, Thailand being with the capital in Bangkok, one would imagine that things would straighten out by now.
Yeah, the reason that we try to get over this no man's land, because when you had Lumen Global in Bangkok, we try to convince the authorities. And now the authorities agree to set up this 13th zone. And I would like to thank the current Minister of the Public Health, Professor Piyasakon Satayathon. He is the current minister, and he understands very well on this STEMI network. And he is the one who commands to set up this STEMI network. And I'm in charge as the council member to try to call all the people from all parts or segments to try to combine. And fortunately, today is February 3rd. In February 14, we'll have the meetings with the Minister of Public Health, try to focus on what's going on after his command to set up this STEMI network. Not only STEMI network, Samir. We have another area that I want to tell you that we have another area of all cardiovascular network. Like my hospital covers zone number 5, that is have 5.5 million people. We'll cover all for complex congenital heart surgery, complex congenital heart, structural heart intervention, endovascular therapy for aortic diseases, and also the heart transplantation project for all these provinces. So this is something that the minister himself, he wants to give this as a present to Thai people in year 2018. And the meeting will be ongoing on February 14. I hope that I'll bring some more education from Lumen Global and try to give this information to the minister. And if he buy the idea, then perhaps we can have Lumen Global in next 2 years term in Bangkok.
Absolutely, and his choosing February 14th is giving a gift of life to the people of Thailand on Valentine's Day. That is very appropriate. Damras, talk to me about pharmaco-invasive management in Thailand. How relevant is it? I was discussing with Dr. Hiramat that for pharmaco-invasive management to be as effective, truly for the purpose of providing care for the people who are away from cath labs, would be early presentation, because if the patient is presenting early, I really do not see benefits of any pharmaco-invasive. And as impressive as encouraging pharmaco-invasive management seems to be in India, when you truly look at the result, like from the CREATE registry, if a patient is presenting at 6 hours, I do not see much role of pharmaco-invasive.
Yes, in Thailand, as I mentioned, we have 77 provinces. We have 160 PCI centers, but it is maldistribution.
Right.
In the suburb, in zone 1 to zone 12, that is outside Bangkok, they have only 1 or 2 centers per region that cover 5.5 million. So it's not possible
Right.
to have those patients to go to the PCI center. Second, we don't have the ambulance system exist. We don't have 911, we don't have 108. We have only 1669. The ambulance system has been established for trauma, for emergency trauma care or something else, but not cardiac. So patients has to go by themselves to the hospital, and we urge the hospital to think about pharmacoinvasive. In the past, they just refer for PCI. As I mentioned, it is ePCI. It has been conducted more than 2 hours during transfer. And ambulance was not there. Ambulance was somewhere else. And then when they call ambulance, it takes time for ambulance from spoke to hub. So I commend as command by the Minister of Public Health, try to promote physician to know how to handle with thrombolysis and then transfer for pharmacoinvasive.
What is the situation, Damras, with the ambulance care, ambulance efficiency and centralized ambulance systems in Thailand? Because Thailand, I don't think is a developing country. It's very sophisticated. In the area of medical tourism, you provide some of the best care globally. So I don't think it is necessarily a lack of resources. Maybe sufficient intellect has not been placed into creating it, and for whatever reason, the purpose and the value of a centralized ambulance towards saving life has not been recognized.
Actually, as I mentioned, 1669 is the call for ambulance system. It worked very well in Bangkok, in just Bangkok metropolitan. But this 1669 does not fit for the outside Bangkok. Outside Bangkok, they still need local ambulance from each big hospital, the regional hospital. So I should mention that 1669 is for Bangkok Metro, but because of the crowded traffic, sometimes 1669 could not get to the patients on time. So the patient seeks their own self-transportation to the hospital. But the only reason is we do not publicize to the people to know that which hospital is a PCI capable, which hospital is non-PCI capable. And we have in PCI capable hospital, we have 2 sets. The first set is 24/7, and second set is 8/5. Patient don't know. So we have to publicize to give information to the patient. That is one part that I would put into this the minister meeting for the STEMI network.
So there are 3 ways to address and bring this patient awareness. One would be the societies. The societies, the Interventional Society, which I was fairly involved with when we did Lumen, located out of Bangkok. Then you have the Thai Heart Association, which is also very active. The second would be the role of the media, and the third would be also industry, which I think should partner more and more closely with us. I know that the work I have done with telemedicine in South America has been funded by the Medtronic Foundation. Have you tried to seek them to help you with some educational aspects?
Actually, we try to copy Latin, the telemedicine in the South America. We asked Medtronic to help sponsor for this telemedicine group, but finally, the process was not work out as we expected because of the system, logistic system. But we think about try to have some telemedicine device and also the education, try to give education to all people, and including all the spoke. In Bangkok itself, we have several hospitals, spoke hospitals, that they don't know how to manage. They don't know how to manage the patients. We have a lot of patient delay diagnosis and delay transfer to PCI capital, even in Bangkok. So I think to get the telemedicine platform protocol is one of the best. So, but now it is rely on logistics. I mean, support, sponsor from the industry, sponsor from government, try to, if they think this is a big issue. For society, we have two society, but now I do not involve in the society activity, but we convince them that society should, step forward and try to give more education to the public, try to give more and more and more, get people together and try to make us more strong in, we call alliance. I heard today from Singapore, from Professor Tan Hui Chin. His idea is very nice. I'll think about that. For those hospitals who perform just only 8/5, they should combine. 3 or 4 hospitals should combine and rotate each day for 24/7 service. But this is just a concept, but I'm not sure that we can proceed this in the future or not. This concept has been tried in outside Bangkok. In some provinces, 100 kilometers away from Bangkok, there are 2 hospitals, one private, one government. Those who work under government, they work just only 8/5. And then after evening, they go on private practice. In private, they can do any time, but because of reimbursement, the private could not do on the poor. But we foresee that STEMI should be treated, effectively in all class. Rich, poor, middle class should have the same treatment because the stent save a life.
Absolutely.
Because primary PCI save a life. So we try to convince them to join force. So I learned many things from Lumen Global this year.
My last question to you, Damras. What about prevention? I also mention that because I am profoundly affected by your nation's spirituality. I have often said that it compares, may even be more favorably disposed than India, and I have hugely benefited from spiritual cardiology and various other aspects in which I think Thailand leads possibly not only the ASEAN region but the world. So are you able to incorporate aspects into prevention?
Yes, now preventive cardiology is much progress. First, we have convinced people to exercise. Now, in the country, everyone knows that first we should have a weight reduction. We have to stop smoking, and smoking campaign in Thailand is so perfect. The number of current smokers is decreasing every year, and people do more on it. do more on exercise. They run, they jog every weeks, every 2 weeks. They have activity, try to promote people to do exercise. So for prevention for STEMI, I think Thailand is one of the best places that people know how to do the preventive measures.
Fantastic, Damras. It's been a joy speaking with you today. You acted most beautifully participated in today's proceedings. We wish you good luck and look forward to interacting with you.
Yep. Thank you.